Welcome everybody to the Community Mental Health Transformation webinar. We'll be having a focus today on traveller communities. My name's Eloise Thompson. I'm Programme Manager for the Community Mental Health Transformation Programme. I'm just going to be chairing the session and I'm just going to start today just by running through a few housekeeping rules, if that's okay. Brilliant, thank you. So if everybody can just please ensure that the cameras are turned off as we're listening to the presentations. It just helps us to keep a bit of a focus on what we're hearing. Hopefully everybody is already automatically muted, but if anybody hasn't got their mute button on, if they could just please turn that on, that would be fabulous. The session will last about 50 minutes in total. That will include about 30 to 40 minutes hearing from our presenters, and then there'll be some time at the end for any questions that people may have, or just any thoughts or considerations people want to feed into the discussions. If anybody does have any queries or thoughts during the time that our presenters are talking, if people wouldn't mind just please popping that in the chat, and then if there's stuff we can answer, we'll do so as the webinar's going along, but otherwise we'll make sure we'll bring back some of that in that question and answer session at the end. I've just seen a chat question. So yeah, we are recording the session. If anybody has any queries or objections to that recording, if Janine, if you could just put your email address in the chat, then if anybody's got any queries or issues around recording, they can get in touch with you directly, if that's okay. And yes, the slides will be sent to everybody, so all of the content will be circulated to all attendees following the session. Okie doke. So as I mentioned, today we're going to talk about all of the work that we're doing with the traveller communities and the efforts to reduce health inequalities across these communities in Lincolnshire. We are very fortunate to be joined by Amy Squire, who's our Lincolnshire Traveller Communities Link Worker, and Paul Boucher, who's the Lincolnshire Traveller Initiative Director. So if it's okay, folks, I'll hand over to both of you guys to take us through your presentation.
Are you going to introduce?
I'm just waiting for Janine.
Can you see that?
Yeah, perfect, Janine. Thank you. Just go on to the next one. Thanks, Ella. Thank you. So good afternoon, everybody. As Ella mentioned, my name's Amy Squire. I'm employed by LPFT in the role as the NHS Wellbeing Link Worker, working with the traveller community in Lincolnshire.
I have to wait. Oh, hi, I'm Paul Boucher. I'm Director of Lincolnshire Traveller Initiative. We've been around for 25 years working with the traveller communities in the county, and it's true to say that the biggest growth area in our work is preventative health care.
So Ella's already touched on them, but just the aims and objectives of today, just to learn a quick overview of who the traveller community are and where they live within the county. A brief look at some of the health inequalities faced by that community and some of the reasons for them. And these are reasons as documented through research, but also some of the reasons that the community themselves have given to us. The ongoing efforts between myself and LTI to combat some of these inequalities and what we're trying to do to promote good health within the communities. So we're just going to start with a look at who the travellers are and what we mean by the term travellers.
So who are the travellers? And traveller is an umbrella term which includes quite a few distinct groups. So we've got English, Welsh and Scottish gypsies. We've got Irish travellers, new travellers, which used to be called New Age travellers, but it's not PC to say age anymore. Don't ask me why, but it's not. Would have called them hippies perhaps at one time. Roma, which is the name for European gypsies, and then circus show people, and bargees and boat people. And Gypsies and Irish travellers are recognised ethnic groups according to English law, and therefore they're protected under the Race Relations Act. Incidentally, Gypsies are by far the largest group in the country and indeed in Lincolnshire, followed by Irish travellers. Roma in Lincolnshire, there are quite a number. They're the group that are least likely to ascribe their ethnicity, so they're probably more hidden in some respects. A lot of Roma people will simply say, oh, I'm Latvian or I'm Polish, without saying that they're Roma. And then the bargees and boat people, more prevalent in countries in Europe like Germany and Holland, where they're plying their trade up and down the rivers. But they have suffered quite a lot of discrimination in recent times, where there's been enforced sterilizations and children removed from families. So each community is distinct and unique, and I have to say, don't always get on well with each other, but we can sort of come into that a little bit more later.
Thanks, Janine.
So where do travellers live? It's estimated there are about 300,000 travellers in the UK and between 2,000 and 3,000 travellers in Lincolnshire. They are estimates. They do counts in each county, but the counts are a bit arbitrary. They do caravan counts and various calculations. But of course, travellers move in and out of counties, so it's not a very exact figure. In Lincolnshire, there are 4 council-owned traveller sites: Boston, Gainsborough, Grantham and Lincoln. I think it's fair to say that council-owned sites are not often as nice as private sites. They're often in not very desirable places, near rubbish tips, waste ground, near waterways, so probably away from services and amenities, and frankly, perhaps where no one else would really want to live. We then have privately owned sites, and we say 25 in Lincolnshire, could be 25, could be 30. Some are very small, might just be 2 or 3 families. Others could be the size of the council sites. They could be 20, 30 families. And then we have roadside travellers living on waste ground, road verges, etc. We would call those travellers usually highly mobile. They're not sites on the roadside, they're moving on. Or perhaps it's more accurate to say they're being moved on. And then we have houses, and it says it's estimated 75% of travellers live in houses. I question that for Lincolnshire, certainly. The house traveller population are probably the most well hidden and hard to find. We know there are quite a considerable number of travellers in houses in Lincolnshire, but I would put it more around the figure of 40 to 50% of travellers living in houses. Can't be very accurate about that. We ourselves are making great efforts to reach out to the house traveller population. In many ways, they suffer more inequalities than those on sites. At least on sites, we know where they all are, and they know we know where they all are, and the interaction is constant and regular. Further down, it says about the undesirable locations. You can tell how often I've seen this presentation. Beneath pylons, next to motorways, far from services and amenities. And there's been a recent study done on that, and it's really quite damning, really, and a cause for health inequalities. Accommodation itself can vary from a small tour caravan to a luxurious chalet. We were just talking, Amy and I, before we came on about the accommodation. some of the sort of peculiarities. If a traveller bought a caravan that had a nice shower and a toilet in it, that would be removed. So what might be a selling point to us would be a no-no for them. They don't like the idea of running water in their accommodation, and they would regard that as not clean. And generally they won't have pets in their homes, but they would say us Gorges, Gorgia being Romany for non-traveller or non-gypsy, us Gorges, we have pets and we let them in the houses, and some people even let them lick them. So we're dirty Gorges compared with the travellers. And planning permission is an issue. Travellers are being constantly encouraged to get their own land and set up their own sites, but something like 90% of planning permissions are passed for the settled population, but less than 30% for travellers. And we've got an instance in Lincolnshire just recently where a new site had been developed. There were about 20 odd families on there. They bought the land themselves, they developed it, got it all set up, but they hadn't got planning permission. They applied retrospectively, which is something that travellers tend to do. And then after a long legal battle, where barristers charged them an awful lot of money, they were all evicted. And the reasons for eviction were ridiculous. It was said that the road noise was not suitable. Well, that was only affecting the travellers, nobody else. And they said they would put screens up and they would pay for the screens to be put up. And then there was a sort of an army shooting range about a mile or so away. The sound from it was like pop gun, pop for a corpse from a pop gun. They said that was not suitable. I have the red arrows zooming around over my house and you can't hear yourself talk on the phone. But that was another reason for them to be evicted. And at the end of the day, just before Christmas, they were all dispersed, some of them not knowing where they were going. And they paid something like £8,000 each in barristers' fees. So that's where they live. I think we're moving on.
Yeah, thanks, Janine. So we've just got here some examples of some of the health inequalities faced by the traveller community, some statistics. So these have all been taken from a briefing from Friends, Families and Travellers from 2002. When the presentation goes round, you've got the link there for those that want to have a read, and it is a really interesting read, so I would recommend taking a look. So Romany and traveller people face life expectancies between 10 and 25 years shorter than the general population. Alongside that, they also have premature conditions such as premature onset conditions, dementia and frailty. The average person in their 60s is comparable to a white British person in their 80s. So as well as having that shorter life expectancy, the years that they are sort of alive, they do spend more time in ill health. Moving sort of on to suicide, it was an all-iron.
Ireland.
Thank you. All iron. Oh my goodness, I can't say it.
An all-Ireland
study.
found that suicide prevalence is 6 times higher than for Irish traveller women than women in the general population, and 7 times higher for traveller men. I mean, that report goes for Ireland. We ourselves find that with the young people we work with, we teach about 120 young travellers between the age of 11 and 16. There is hardly a child whose family has not been impacted by suicide. It is almost an epidemic in the traveller community, particularly among young traveller men. We might come back to that further on.
Yeah, but definitely something that's raised continuously, isn't it? Everybody sort of knows somebody, who's taken their life. Just moving on to mental health around anxiety and depression. So they're nearly 3 times as likely to be anxious and just over twice as likely to be depressed, with women twice as likely as men to experience mental health problems, yet there's still a huge stigma around talking about mental health. We'll come to some of the reasons around that later on. And then this Equality and Human Rights Commission found that 44% of the British public report having a negative opinion about Gypsy, Roma and travellers, which really, is just demonstrating sort of the social sorry, go on.
Absolutely. If you ask any traveller, particularly traveller women, what's the number one health problem within the traveller community, they will invariably say mental health, for sure.
Yeah, but also sort of in every area, isn't it?
Oh yeah. You
want to mention the mystery shopper?
Yeah, there has been a recent, and I think it's ongoing, survey done by friends, families and travellers. And in spite of, I don't know whether you can all see this, but we've got, whoops, it's making me vanish. We've got the yellow card, which is an NHS card, and it says, I have the right to register and receive treatment from a GP practice. I do not need a fixed address. I do not need identification. Anyone in England can see a GP. And then on the back, it gives a number that they can call for help. And it says, I may need help filling in forms. I may need help reading and understanding, and I'd like to speak to someone confidentially. During COVID, a mystery shopper experiment in London found that I think it was 70 or 80% of travellers were turned away from a GPs for not having an address, not having a fixed address. We ourselves in Lincolnshire, when travellers move into the county, the first thing we do is get the travellers registered with a GP. We've experienced difficulties with that. We've been asked for bank account details as a qualification for registering with a GP. I've waved the yellow card at receptionists and been told that's not our policy. So these difficulties still exist, and that mystery shopper experiment research is going out sort of throughout the rest of the country. So it's quite shocking and very worrying.
Just touching on there with the issues of registering as well, like Paul's mentioned, the lack of fixed address, but also some of the issues we're told about are the registration forms being so lengthy, people feeling embarrassed to ask for support, that waiting rooms and reception areas are busy, so they don't like to sort of admit that they might struggle with reading and writing and filling them in. Also, the community highlight the lack of understanding from professionals around the traveller culture and traditions. So sometimes they feel judged for not living in what we might call a conventional style. So as Paul said, they'll have very separate washing and food preparation areas from their living area. So often the bathroom might be outside. So they feel judged that people don't understand that. The strong family values, so the importance of large extended family and the gender roles where the men traditionally will go out to work, the ladies or the females will become sort of the homemakers. It gets flagged up a lot that professionals maybe don't understand why they want to take family support along to appointments, or they might have sort of 2 or 3 members of family in tow. And then a reluctance to discuss or seek support for certain subjects. So there's still some areas that are very sort of taboo amongst the culture, isn't there? Sort of mental health being one. Anything sort of domestic abuse related, there's a reluctance to talk about. Anything that's seen of being maybe of a sexual nature, so that could be around sort of cervical smear tests, anything sort of involving.
We had the sexual health team come and talk to one of our well woman groups, and frankly I think it's a shame it's called sexual health team, because that in itself is a huge barrier to get travellers to come and talk to or listen to that group. There were 4 or 5 women as a result of that interaction with the sexual health team that went for their first ever smear test, and sadly one of them had quite a serious condition, although I think that has been addressed. So extremely difficult to get into certain areas. Vaccinations are not traditionally something that travellers take up. Although we had a real success recently, we had a health day, didn't we, Amy?
Yes, you jump in the gun.
Oh, sorry, I'm going ahead. I shall shut up at this point.
We're going to come back to the health
right
shortly. But as well as that lack of understanding, there's suspicion that health officials or professionals treat them differently because they're travellers. So some examples we've had there. They feel if they admit that they're struggling with mental health, children's services will automatically become involved and remove the children. We've had people saying that services won't visit families on site as soon as they realise that they live on a big site. They'll suggest meeting at a garden centre or community centre, just feeling like they're discriminated against because of their address. Had a lady mention that she feels she's been bumped, or her son, sorry, has been bumped down the autism assessment list because he's currently in year 6, and they know that come next year when it goes to secondary school, he probably won't go to school.
We don't want to just give bad examples, but
no,
I'm afraid, yeah,
examples
they are
of
examples.
Things that the community,
I know,
community have said of why they struggle to trust.
I know on a site in Lincolnshire, I was talking to a traveller lady whose daughter had just had a baby, and she said to me, if I see that, I don't know whether it was a nurse, a health visitor, or what am I after? To do with babies. Yeah.
Midwife.
A midwife. But she said, if I see her again, I'm going to deck her. Because her opening gambit was, oh, the minute I saw your address, I thought, oh, you'll be a bottle feeder then. Because largely gypsies certainly bottle feed their children. That's part of the whole culture. It's very rare to breastfeed. And that poor new mother felt shamed by that sort of comment. The same person also said, oh, because I dealt with so-and-so and named another traveller from that same site. And it was shocking, that the lack of confidentiality even. But it's like, oh, you're all together on this site, you're all the same. So there are some pretty worrying stories.
Yeah. We've already touched upon the stigma within the community around mental health, but there is a real strong belief that we just have to get on with things. Many families will report that sort of learnt behaviour through the generations, again, particularly among men, that you don't reach out or sort of admit that you've got a problem. Digital exclusion is brought up quite a lot. The Ask My GP system, people struggling to sort of get online in the morning. That might be through lack of internet, the cost of phones and tariffs, poor signals if they're on the outskirts of a town. And then when people do have appointments, again, it's mentioned about the struggle to be able to keep them. So the did not attend rates can be quite high. Again, that can be not knowing about appointments. It may be if they're not at a registered address that they don't receive post, being unable to read letters confirming appointments.
And I think it's worth mentioning, for a traveller woman to see a male doctor or nurse is a big issue and a big barrier as well.
Yeah, just the mobility side. Paul's mentioned a lot of the sites are on the outskirts of town, so you've got the cost with trying to get buses or taxis.
Really miles from towns.
Yeah, and it's been sort of mentioned before that some of the sites taxis won't go down to sites to do pickups either. So there's sort of sometimes a struggle to even make an appointment before they've even got there and overcome that barrier of asking for help. We've mentioned, Paul's already touched on vaccinations, which we're going to talk about the Health Day, but also awareness of cancer screening as well. It's been said to me before, I'd rather not know, or again, if it's sort of prostate or cervical screening, there's a reluctance to engage.
I spoke to a traveller lady recently who said there'd been a history of cancer in her family and that she went for cervical screenings. So I then said, rightly or wrongly, I said, when I think of women and cancer, the two areas I usually think of would be sort of cervical cancer or breast cancer. And I said, do you sort of check yourself for sort of breast cancer? And she said, no. And I said, if you found a lump in one of your breasts, would you go and see about it? No, she said. And I was quite shocked because she's very switched on lady and was going and having her cervical smears. And I said, what, you wouldn't? And she said, well, probably not till I was in such pain that I had to. And I thought, oh dear, we can't let that carry on. So we have had the cancer screening teams come in and talk to the well women groups.
And we're going to come to those things we are putting in place.
Yeah.
And we've just got a note there about the non-participation of men in health matters, which again we'll come on to, which is why a lot of the work we sort of do targets sort of the female population, doesn't it?
That we trust that it's fed into the men.
Yeah. So if we could just move on, Janine, please, thank you. So what are we doing? What strategies have we got in place to try and combat the health inequalities? So just the first bit, just about my role. So as we mentioned, I'm employed by LPFT. The role was created 2 or 3 years ago after Paul identified really that they needed health, sort of greater health intervention. So my role largely covers the county, going out, meeting families, just trying to kind of build up those relationships, being present on sites without sort of imposing on their personal space. Tend to visit the larger sites regularly, just to build up those relationships so that the residents recognise us, will come over and approach us. Don't like to door knock, respect that it's people's private space. Let them know what dates we're going to be down there so that they can be available if they want to see us. I'll work alongside the GP surgeries. So as Paul's mentioned, there's a large house community. It's quite tricky to sometimes reach them. So we rely on those referrals from people who might already be working with them. So GPs, social prescribers, health visitors, physios, different charities, sort of had referrals from all of them. But it just means then we can get in contact with them and see if there's anything further we can support with. We also rely on the traveller families themselves, don't we, on site, or those contacts we've got to sort of make those connections with the house community. Just to help us as well. A lot of what I do is sort of general support, so GP, dentist registrations. I get asked about dentists all the time, making appointments, following up appointments. If families are new to the area, it might be that they're already involved in the health system in a different county, so just trying to see where things are at. Again, the literacy support around reading letters, understanding sort of the information they're being given, they're being told. Connecting travellers to the care they need when they need it. So that could be through referrals. Again, I'm going to come to that in a bit more detail further on. Bringing services to the community. So some professionals have said that they can be a little bit wary going down to sites. It could be quite daunting if it's a new environment. So we'll link in with them, do joint visits, help to sort of pass information between the two. And also if I'm going out with another service to provide support, hopefully I'm already kind of familiar face to that family, so it's not as daunting for them. In terms of bringing services to the community, I just want to specifically mention talking therapies, who we work heavily alongside. So within their service, they've got a designated counsellor who is working with the underserved population. So we link in with him quite a lot. His role means it could be a bit more flexible in the approach, sort of appointment times, the location. He can go to the travellers, to their homes, rather than them having to go to sort of an NHS building, which can sometimes put them off. We're also in talks with a recovery college just to look at how we can make some of their courses maybe more accessible for the community. Just a few other bits, just advocating for the rights of the travellers. Paul's mentioned about them registering without an address, so I'll support them with things like that. Trying to support services with engagement and feedback. So myself and one of our engagement team have been going out and talking to some of the travellers around their access to mental health services and their reasons for or for not engaging, and just what that looks like, and some of their barriers to accessing NHS support. And then working alongside partners to organise events. But again, we've got sort of another slide about that further on.
Just a little story on something Amy mentioned there. She mentioned literacy. I think she was struggling with the word.
See,
We went down on a site recently, and as we entered the site, there was a plot just on the left, and a quite elderly woman popped out, somebody that we know and we have dealt with, but not had an awful lot of interaction with. And she waved us over and said, "Oh, you know that dyslexia pen you got me?" And we have got dyslexia pens for 1 or 2 people where children have had a problem with reading and writing. But in this instance, we got a pen for this lady, and she said, "I can read my appointments now.
Yeah.
I can get myself to my own appointments, and I don't have to wait for my son to come." So we actually do a subsidised offer on dyslexia pens. It's something that we've not promoted heavily, but we are going to promote it more. They're a real useful tool. I mean, literally, you follow the words with the pen and it tells you what it's saying.
And I think just the importance there, it's been said to me before by an adult, by a lady, that she doesn't like to rely on her children who attend school and can read and write to read her appointment letters, because they're confidential for her, but also she doesn't want her children worrying about why she might be accessing, sort of the healthcare system.
But it's sort of £30-40, the dyslexia pen, and we'll sort of go halfway on the price of that. Quite a useful tool.
Huge help. So moving on, Janine, please.
Right. I'm conscious of the time because I think we've got quite a long way to go, so I'm going to be really fast on this. So what does LTI do? Education, we teach 11 to 16-year-olds, about 120 of them on 13 sites. Employability, we get a lot of people into work. We've got 2 workers that work on adult training into employment. Health, very much preventative health care, and then advocacy is everything else, and everything else could be driving licenses, passport applications, reading letters, getting kids into school, housing problems, benefits, you name it, it's a one-stop shop. And we've got the LTI health approach. Well, the advent of Amy has been a massive step for us because we've got sort of a road into all the different teams. And having someone who works with us with the letters NHS tagged to them is a big help. And then we have our well woman groups, and we have health champions. We work with the neighbourhood teams. We say it's nurses visiting the sites. They might not all be nurses. It doesn't matter. They're seen as nurses. And we are really working hard to try and develop our partnership with the NHS in various levels. Do I mention we have 2 dedicated workers here or not?
Yeah. We've got
LTI, we have 2 workers. And working with travellers, people talk about working with traveller communities. It's not as simple as that. 2 neighbouring plots on a site could be very secretive about their business, their health, their employment, everything. We have 2 workers who do the opposite to Amy, I guess. They go round and they knock on every door, and they do this monthly, and they cover 13 sites, and they knock on every door and they leave a leaflet that's got their photographs, their names, and it says, "We can help with anything that's worrying you, any health matters you've got, any concerns, any planning, any training that you want," a whole list, a very simple leaflet. But the key is to keep going so their faces are known. And I mean, they've worked for LTI for 7 years, but round and round and round, again and again and again, so that you are part of the fabric of that site almost. And that unearths quite a lot of requests for help. Yep.
Thanks, Janine. So Paul's already touched on who he calls the nurses. Keep telling them they're not all nurses, but we do a lot of work alongside the neighbourhood teams. So again, I'm not here to describe their role. I wouldn't do it justice to talk about their role, but really it's just to say how valuable that work is for us. Whereas sort of our roles cover the whole county, they work a bit more sort of specifically in one area. So their wealth of knowledge they have about each local area is invaluable. They have sort of the links in with the different surgeries, schools, food banks. They sit within sort of core meetings, MDT meetings. So they are able to kind of build a lot of those bridges that I'm sort of unable to. We have in 3 areas where I meet with the staff regularly, and we'll go out and do site visits. We're quite well known sort of on most of those sites, to the point, like I say, where people will now approach us if they've got any concerns. Again, I'm conscious of time, but they, you know, sort of with consent, they can access health records, they can see where people are at with vaccinations and annual reviews. Because a lot of them come from clinical backgrounds as well. They understand that vocabulary of some of the letters, again, that I might not be able to. So yeah, it was just to sort of say really how much we value the partnership working alongside the neighbourhood team.
I will just jump in where it says regularly visit 3 sites.
Yeah.
I know there's a house population in Henswell that's now being visited.
That we're looking, yeah.
And we're looking to get the visits on a lot of the sites, So
whilst we regularly visit 3 of them, we are linked in with other areas. It may just be that we don't have sort of a routine sort of visit every week or whatever it may be. Thanks, Janine. The next slide, which I won't go through them all, but it's just one example. Thank you. At one large site within the county, there's about 20 different plots on that site, so it is quite big. But this is just a list of all of the organisations or services that we've linked with for that site. There's probably a few more, to be honest, to now add on to that. But I won't go through them all just because of time. Thanks, Janine.
Then we have our community health champions. They are champions for their own site, their own area. We have community champions on Grantham, Gainsborough, Holbeach and Spalding, and we're looking to develop that further. These are community members. We do pay them. We pay them an honorarium. It's not a lot of money, and it's not exactly why they do it, I don't think, but it is useful to have traveller people themselves. They will feed in issues from their sites to us and then in turn to Amy. So that's their role.
Thanks, Janine.
We are skating through now.
Well-woman groups.
The well-woman groups, we've got 4 well-woman groups, I believe, at the moment. The Gainsborough one's been going for years.
Yes.
They've done all manner of things. They've raised money for charity themselves. They gain qualifications. They gain employment. They're part of trying to develop new well-woman groups. Worcester University has done a bit of a study of our well-woman groups, and they're trying to replicate that model in the Worcestershire area. Working through women's groups, it seems to be the way to feed things down into the family. So if they're going out on the walking trips, we've given them all pedometers and they do walking, and then you find in their own time that the kids are out walking with them, and then hopefully the husbands are doing the same. They've all done health training. 13 of the Gainsborough well-woman group did the mental health first aid. All of the children we work with do first aid. When I talk about preventative health care, all of our young people do well-being courses from the King's Trust, as it is now. So they do healthy eating, they do physical health, and they do nutritional health. They're accredited qualifications, but we believe let's start young with teaching preventative health. So that's that.
Yeah.
We're rushing now. So
thanks, Janine. Again, this is just an example, isn't it, of some of the activities that the well-woman groups have done, or services that have either been to some of them or that we're sort of in talks with, who have expressed interest in coming. So again, I'll let you just have a read through that when the slides come through.
That's just a map of the areas that we cover, and it is pretty much the whole county. I think we've sort of made reference to most of what's on there already.
Just at a glance. Thanks, Janine.
Here's the young people having their first aid training. Defibrillators on site. We had an underspend. Can't be doing with underspends. So I approached the lottery whose funding we'd underspent. This was during COVID, and they allowed me to put 7 defibrillators on 7 sites, the 7 largest sites. And we put smoke alarms and carbon monoxide detectors in. Yep, that's our health training and education.
So different events that we've either delivered, support with, or attended. Paul and I were both involved with some of the ICB health inclusion workshops. They've been running a series of them over the last couple of years. So there's one around the Gypsy Roma traveller community. I think we've done 3 now, held over at Waddington. I'm sure some of you have probably been to. Paul's mentioned about the children's health event. So it was last December, early December. We held an event again at Waddington Hub, didn't we, for the traveller community in partnership with the ICB. And had the vaccination team, oral health there, Healthy Minds, and the virtual autism hub.
7 vaccinations.
Yeah, and still signed up, wasn't there?
Signed up for, yeah.
But all areas where some families had raised concerns. So we deliberately sort of kept it quite low key, just as sort of the first launching event. And I know there's now talks about doing a larger scale one over the summer, isn't there?
Yeah, is that on there?
It's on the upcoming.
Right.
But it's in the process of sort of being arranged, I think, alongside the ICB. Some of the ladies had expressed interest in learning more about the menopause, felt there was very little information out there. So again, we had Paula from Everyone over to deliver a session, and we're in talks with her about doing one on one of the sites, because a group of the ladies down there have expressed interest again. We did a event for the safeguarding LPFT safeguarding champions. It was around cultural awareness. So again, just about the traveller community.
University of Lincoln, 40 third year social workers. That's now going to be an annual event. So as the trainee social workers come off the conveyor belt, so to speak, they will all receive training from LTI. Sadly, of all the professionals, the social workers are the ones that are least favoured by the traveller community. They're very suspicious. They think they're going to take their children off them, basically. So we're working to sort of put that right.
Yeah. And just touching on there, I'd attended 2 of the suicide conferences. Again, we've already highlighted huge concern amongst the community. So really, it's sort of ideal for networking, seeing what services are out there, what kind of community work they do, and how we can sort of incorporate that or work together.
The film, have we got that on the slides? Jake Bowers films.
Yes. Yeah.
Yeah, I'd recommend you view the. I think it's coming up.
It's coming up.
We'll tell you about it.
Move on, Janine.
Yeah.
Thank you. So again, just quite heavily, or Paul especially, quite heavily involved in research, aren't you? Get approached quite often to.
Yeah, there's quite a few research studies done on our work. I think we've had Lincoln University did a research study. Worcester University have engaged with us on research work. I think there's Jake Bowers has just produced Reaching for the Rope, Mental Health in Gypsy Roma and Traveller Communities. I strongly recommend you view that, a series of 3 short films. Jake Bowers is a Gypsy journalist and filmmaker. And the 4 lessons that you got the links to there, I strongly recommend those as well, produced by Worcester University. We find engaging with universities and researchers promotes the problems and the issues facing the traveller communities, and it gives it quite a strong voice.
Thanks, Janine. Just another page, the one you mentioned through Lincoln University.
Yeah, there we are. And Cosmos, they did a research. The links are to all of those, and there's some really useful stuff. There's a new one just come out, some research we did with who was it?
That was Peter as well.
Oh,
Wasn't
that
it?
was
just come out
Worcester
today.
University. That's just come out today. That's a really good read, but it's not included on here, but we'll get that added to it.
Yeah. Thanks, Janine. So just what's coming soon, what's in the pipeline. So LPFT, as a trust, we're currently exploring having some traveller community engagement workers. So they will hopefully be individuals directly from the community themselves. The idea, they'll act as a point of contact for their community, a bridge between their community and staff. They'll be able to offer advice on sort of how we shape services, the delivery of them, training, events, material, just sort of raising awareness and educating on the traveller culture and traditions. We're looking at having a dedicated page on Hay that will be places sort of to signpost travellers directly, so it'll have the likes of LTI.
LTI has a page.
You've got a page, I know.
Yeah.
You'll have it twice. Different services. There's a brilliant counselling service called One Call Away, which was set up by a brother and sister from the traveller community. But it'll have that signposting just sort of dedicated for that community. I've already mentioned I've been in talks with the Recovery College about how we can make their courses more accessible and relevant for the staff, for the community, how we can maybe use them through the Well Woman groups. But that's sort of an ongoing discussion at the moment.
The Summer Fun Day event is the next sort of young people's health day, if you like. We get something like 200 travellers attend that Fun Day event. And we'd like to have some of the health teams present because it's hard to get travellers together in such numbers. So we're looking at doing that. Likewise with a creative event at Bishopsgrove Test University. We're developing an online learning hub. On that online learning hub, our young people are doing their functional skills, maths, English and IT and their King's Trust courses. But we're also going to put first aid on there, and we will put information on mental health as well. We have a LTI Health website, but it's sadly out of date. It needs updating and upgrading. Amy's been sending me stuff to get put on there, but we would welcome anybody that wants to update stuff on there to get in touch. And of course, engaging more widely with the house population, traveller population is on the cards.
Thanks, Janine.
Top tips. We really sit.
Yes, let's wrap up.
Top tips. My top tip would be if you're going to visit a traveller site, you've got reason to visit a traveller site and you're not familiar with that traveller site, I would take somebody that knows the site and knows the people and is trusted by them. Yeah. Use simple language, jargon-free. Travellers won't tell you they don't understand it. Times that I've had someone talk to the travellers and when they've gone, they said, Paul, they didn't understand a bloody word. Avoid acronyms. I know you love acronyms. Even we've got LTI, but avoid acronyms. Be friendly. Don't rely on written information. Be aware of the yellow card. If you're unsure about anything, just ask. Be aware of past experiences. Avoid taboo subjects, sexual matters, money, business. Don't pry into their business because they're very, very sensitive about that. I would say dress casually. The nurses, as I call them, if you like, at first used to arrive in full uniform. Now they're known and the uniform's gone, but there's nothing wrong with the badge. Wear your badge with pride, and don't make empty promises. The travellers are very sensitive about being let down. They're very often let down. They're sick to death of being surveyed and then no action. So I would say don't make empty promises.
Yeah. Thank you, Janine.
Don't know how long we've got.
Quick wrap up there.
Any questions?
Sorry.
Thank
Paul,
you so
hear
much.
me?
Oh, sorry.
I was just picking up on
Laura.
a question, Ella, sorry.
No, that's okay. You go, Laura.
There's a question in the chat, Paul and Amy, so you won't be able to see it because you were looking at the presentation. Somebody asking if there is an online link to the yellow cards, please.
If anybody wants to contact LTI, I will get them a contact for the yellow card. It's not on the card, unfortunately.
No, I don't know where you got
I've got a box full of them, so they are readily available, but I can't give you the detail at the minute.
Okay, so the LTI contact information is in your presentation, so people can find that when they receive the presentation, can't they?
Yeah. In
Okay,
fact,
thank
we'll
you.
find an answer to put out. We'll put an answer out when we send the presentation out.
Thank you. I'll leave it back to you now, Ella, sorry.
No worries. Thank you. I just wanted to say thank you so much, Amy and Paul, just before we launch into questions. It was just such a informative and actually really impactful presentation. Actually, I've got loads of things going on in my head and questions, but I'm going to just offer to folk in the session. First of all, there's loads of chat just for you guys about how informative and useful that presentation was. Emma Louise.
Hi, so I'm a Health and Justice Partnership Coordinator for Lincolnshire Probation. It's not really a question because I think the presentation was excellent and you covered everything, but it was more just a request to link really, because we do have people from the travelling community within, you know, access within the probation service in the criminal justice system. So and obviously one of my roles being in terms of making sure that they have access to health. So I think it would be really great if I could link with you really, and I'll send you a message afterwards just to get a meeting booked in. That'd be brilliant.
Yeah,
always pleased to hear. Yeah.
No, great. Thanks, Emma Louise. Donna.
Hello. I'll just put my camera. Hello.
Hi, Donna.
I'm a peer support worker and I work for Shine Lincolnshire and also the integrated base place team. And I'm based in East Lindsey Meridian. And I am actually supporting a gentleman that's from the travelling community, but he now lives in a bungalow. And I've been working with him for about a year and he is making progress, but I'm really struggling at the minute because he's really struggling with his mental health. But the groups that I've sort of like said to him to go to, he tells me they're not his people. So I'm a bit at a standstill. I don't know if this is something you can sort of help me with. They're very proud people, aren't they? It's like he's got COPD and he can't walk very far. So I said about a mobility scooter. No way will he be seen in a mobility scooter.
There's two things I would say. You could ask him if he would allow two of our team to visit him.
Oh, lovely. Yeah,
because they do that regularly. And regards mental health, there is the One Call Away, which is run by gypsies themselves.
Okay.
We could get you details of that.
If you
yes, please.
Email me, Donna, or email Paul or I. We've just mentioned the counselling service Paul mentioned is run by brother and sister from the traveller community who set up for exactly that reason, because they found a lot of the community didn't want to approach sort of somebody who wasn't from that community.
Yeah, he came into our services. He lost his partner, so that's massive, and it's just like been over a year. But then obviously he's got this COPD, so he can't do, and he spent all his life in like a trailer, working on the roads and things like that. So it's really, really hard. And he's lovely, and you know I've got him where I think as far as I can, but I'm struggling for him to engage with people, you know, sort of like groups that I know. So when this come through to me, I was like, oh my God, this is great.
Drop us an email, Donna, and then we can always talk, one-to-one and see, what
brilliant.
We can do. All right.
Yeah. Oh, fabulous. Thank you ever so much.
All right.
Thank you.
Thanks, Donna. Has anybody else got any other questions or just thoughts? We've got some just comments in the chat, Amy and Paul, just about how much people have learnt from the presentation, and I think the impact that it's having on people about how they need to think a bit differently about how they are themselves working with the traveller communities. So I think that, you know, that's really, really great to hear already. Is there anybody else got any questions? I've just got a couple because I always have questions. Or probably thought, I know, I'm so sorry, but it's just so interesting.
Sorry, we have to wrap up so quick.
It's been very garbled because
Paul was worried.
No, it hasn't.
Time.
Oh my goodness, honestly, guys, you've just done an amazing job in presenting it, and the work that you do in the Lincolnshire Traveller Initiative and the work that you're doing, Amy, is just so amazing. I guess one of the bits, and I think you kind of did answer it a little bit, but when you were talking about mental health and I guess the stigma and how hard it is to access services, I suppose in my head I was thinking, actually then how hard must it be for individuals to then actually go from that initial access to actually going into services and actually receiving those interventions, because it can be hard enough to make that first step, can't it, into telling somebody that you're struggling, never mind then actually receiving the support. And I was really interested to hear when you talked about talking therapies and how there's that flexibility with provision. So it was just that stuff I was just really interested in terms of the actual interventions people are receiving.
One of the key things that our two team members do is they handhold people to appointments, be it doctors, dentists, mental health services. They'll take them to their appointments and bring them back. So that's a key part. Or we'll, if we can bring the services in, we'll be present for the first session. I mean, we know it's personal and private, but we will handhold to get the whole thing going.
So I think, Ella, when I mentioned talking therapies, James, who we've been working alongside, he comes to some of the Well Woman groups where he'll introduce himself in a group setting. So there's no pressure, you know, it's just, this is, you know, who I am and where I'm from. This is the sort of thing we can support with. Obviously, then if you start seeing people on sort of a one-to-one basis, it would be more, you know, obviously more private. But I think just because he can go out to people's sort of homes or their safe space, their sites or their areas, it's a lot better. Now, it's possible with every service that isn't possible. So those maybe are under maybe some of our other mental health services where they just don't have that capacity to go out. Then we'll explore, okay, is there a different way? Can it be done via Teams? Can it be done via phone? Can, you know, the LTI staff take them to the appointment so they've got somebody familiar go in? They won't go in, they'll sit outside, but just to make sure they get from A to B and they've got that kind of familiar face.
Yeah, oh, that's brilliant. Question from Rachel.
Not a question, Eloise. It's just to say that actually we've actually spoken to Amy last year. She came into South Lincoln place-based teams. We said that we're actually quite flexible with how we work, and we are prepared to work with travellers coming to wherever suits those. So that option is there for South Lincoln. That is there.
Your place, the integrated place-based. Sorry, Paul was asking me what team you were from, Rachel. You're the integrated place-based team, aren't you?
Yeah, but obviously my position is the Oz, so I work in the surgery, but in linking with the place-based teams, which means that I link in with CMHT.
Yeah, I'll tell you.
So yeah.
It's like it's just all these abbreviations.
You
who
love
are they?
You love an acronym.
You'll be pleased to know, Paul, I normally can't get the acronyms the right way round. Never mind say them properly. So I struggle as much with them.
I can't get any words out.
I suppose again, just another thing that I think you answered. I'm just so interested in the work that you're doing, and I wonder where else this does happen in the county, really. But I think, as you described, Paul, when you were talking through the different research projects, actually it's probably a bit of a model that is envied in other areas, and so not something that is around the rest of the country. Is that right?
There are very few. How can I put it? I mean, there are one or two excellent traveller support organisations, Friends, Families, Travellers, for instance, and the Traveller Movement. And Leeds Gate and Hearts, but not that many. A lot of campaigning, rather than hands-on on the sites.
Yeah, they're more
Yeah.
bigger government initiatives,
Yeah,
aren't they, rather than local.
We sort of pride ourselves that our work is literally on the site with the travellers doing, rather than campaigning. I'm not saying there's anything wrong with campaigning. I know it's important. So I don't know, is there that many mobile classrooms going around? And when I say a mobile classroom, it covers for health as well, and adult training. So, but there are inquiries from elsewhere to set up a pattern based on our work.
Yeah, I think there's so much learning actually for a number of different cohorts of populations that I think are really struggling to access services as well.
And I think
Laura,
Ella, from the research that Peter did as well, because he looked at 5 different areas or 5 different counties in the country, and I think we are the only county who has sort of the traveller link worker role within the NHS as well. I don't think there are any others in the country.
The traveller link worker role has created quite a lot of interest in other areas for sure. It's pretty much a first. So it's generating a lot of interest. So Lincolnshire can be proud of itself.
Yeah, absolutely. You've got
the neighbourhood teams can and should be proud of themselves as well, because that's not happening in many places. And of course, travellers move in and out of the county, and we get asked all the time. I mean, I shouldn't say this. I'm working with a Nottinghamshire family because they were in Lincolnshire, and there's nothing for them in Nottinghamshire. So I sort of shouldn't be, but because we're stretched as it is, but you can't turn your back on people, can you?
Funnily enough, Vicky and I from the neighbourhood were at a site the other day, and there was some visiting family members there who said to us, "Is there anything the same as you in Leicestershire?" Because we live in Leicestershire. We said, well, I don't know, without looking into it, I don't know, but yeah, they were asking.
Laura.
Oh, no.
Thank you. It's just to pick up on something in the chat. With regards to the yellow card, the person would also be interested in whether they can get it electronically so they can share it on Traveller social media. And then there's a follow-up question about, do the statistics and engagement include the Bargees boating community? You know, the information you shared, there's a question in the chat saying that as well.
I think because those statistics, like I say, came from friends, families and travellers, and the link to where the document that they came from, that briefing, is on there, so that would say exactly who you know, they questioned for those statistics. I don't know off the top of my head, but yeah, that link is there.
Super, so they can have a look on that, can't they?
Okie dokie, folks, I can't see any more hands up. I could just sit and talk to you, Amy and Paul, all afternoon, but I will need to close the webinar. But thank you so much. Thank you everybody for joining us today. But special thanks, Amy and Paul, for presenting to us and for providing us with such a informative and I think just really meaningful in terms of all of the work that you're doing and you know how much that stuff must really matter to the communities that you're working with. So thank you so much. Yeah, I think if there's nothing else from anybody, we'll close the webinar. Thanks ever so much, everybody. Take care.